Hi, I'm Haley Bria, and I'm going to be discussing electronic health records and HIPAA. So, what is an electronic health record? It's essentially a patient chart that houses all the information about that patient, including their clinical data, their patient education, clinical guidelines for their treatment, and confidentiality standards. This includes all of the patient's information from multiple sources, so it allows clinical data to be accessed from previous visits and other conditions. Access to the history and previous medical visits can become a valuable resource for decision making about their treatments or any new medications we might be putting that patient on. An electronic health record is also a very valuable tool for communication because nurses are able to consult doctors and other specialties to coordinate care for a specific patient. So, what is HIPAA? HIPAA stands for Health Insurance Portability and Accountability Act. This is an act that was created to protect the patient privacy and confidentiality. And HIPAA prevents discussion of any patient information regarding patient identifiers such as name and date of birth. And nurses are only permitted to access charts of the patients that they are directly involved in the care of, regardless of who that patient is, to protect that patient confidentiality. My evidence-based article studied electronic health records and how they impact patient care. There were advantages and disadvantages to the use of electronic health records, and the advantages were found to be that electronic health records provided efficient access to all of the patient's information. It also reduced test duplication because providers were able to see the test results in the electronic health record. It improved interdisciplinary communication, and it also increased evidence-based practice to base decisions upon. Disadvantages included the increased risk for cyber attacks just because these medical records contain all of the patient's information, including their medication, their history, all of their health information. Electronic health records also can be very expensive and time consuming to manage, and they also pose a problem whenever there are power outages or emergency situations because these electronic health records require online access through electricity. The two BSN essentials that best correlated with my topic were informatics in healthcare technologies and interprofessional partnerships. Informatics in healthcare technologies ensure that nurses incorporate competencies like interdisciplinary communication through the electronic health record and a collection of data in a central reserve space. This also allows for better, more informed decision making with the easy access to all of the patient information in one area. And it improves nurse patient communication just because the patients are able to discuss with the nurse any questions they might have about their chart. Interprofessional partnerships ensure that nurses have team based care, which is accomplished through collaboration in the electronic health record. Interprofessional partnerships also ensure that nurses can respect patients as they communicate and collaborate with others and maintain that confidentiality when they're discussing patient information. The two Q-SYN competencies that best correlated with my topics were informatics and teamwork and collaboration. Informatics includes the navigation of the electronic health record and technology, and this encompasses accurate documentation, patient information, and the healthcare record, and maintaining that confidentiality. Teamwork and collaboration includes interprofessional communication, which is accomplished through electronic health record sharing and is useful in care handoffs. This competency is also used to maintain confidentiality and respect during that interprofessional collaboration. My reflection question is, a nurse is inappropriately using the electronic health record to access the chart of a patient that she knows personally and disclosing information to others. What would you do if you encountered this situation? This is my references. Thank you.